Hi, everyone, and welcome to our presentation titled International Society of Wheelchair Professionals, or ISWP, Learning Modules for Wheelchair Service Providers. You can see the contributing authors listed there on the left. You can see we have 6 learning objectives today. The first is looking a little bit at who the ISWP are, as well as a special look at our integration subcommittee, a quick review of the World Health Organization 8 steps and our online education modules, a quick scan through of our project methodology, our results, our knowledge translation plan, and a list of some of the resources we've used. Krithika will start first by describing the ISWP and the integration subcommittee.
Thank you, Amira. So as a background, 70 million people require appropriate wheelchair to enable them to participate in their communities. The World Health Organization estimates that only 15% have access to the products and services they require. Lack of appropriate trained personnel to provide the services is one of the key barriers to meeting the global wheelchair need. The enactment of the United Nations Convention on the Rights of Persons with Disability and the publication of the WHO guidelines on the provision of manual wheelchairs and wheelchair personnel training packages raised global awareness of the immense and urgent need. ISWP, to build on this momentum, was established in 2015 to serve as a global resource for wheelchair service standards and provision through advocacy, training and testing, standards, evidence-based practice, innovation, and a platform for information exchange. University of Pittsburgh's extensive experience in wheelchairs and mobility enabled us to receive a grant to launch the International Society of Wheelchair Professionals in 2015. We are funded by the United States Agency for International Development. This slide shows representation from various organizations in all our working groups. We are grateful for all the working group members for volunteering their time in our activities. And these numbers show our global impact and how widely some of our resources have been used. We focus on improving the lives of wheelchair users, especially those in less resource countries, by advocating for governments to pay for appropriate wheelchairs and services, training clinicians on fitting clients with appropriate wheelchairs, and educating wheelchair users on how to use and maintain their wheelchairs. Improving the quality of wheelchairs by working with manufacturers, suppliers, and wheelchair technicians. Everything we do is based on research and or has the opportunity to contribute to additional research to improve the lives of wheelchair users worldwide. We professionalize wheelchair services around the world, benefiting both wheelchair users and those who help them by promoting the WHO guidelines for wheelchair service provision and by promoting training and research. These are some of our activities in a nutshell in both service and product standards. The integration subcommittee falls under the training working group, and we have 10 members from various universities and nonprofit organizations. And the purpose of this committee is to integrate wheelchair provisioning into pre-professional training curricula via evidence-based training materials and methodologies. The content of ISWP's online module is based on WHO's wheelchair service training package and other evidence-based materials. They're being used by universities, NGOs, multi-tenant access features. The availability of these courses will significantly reduce the number of in-person training days, as well as the cost, and expand the number of people who can be trained. The online modules were created using Articulate Storyline 360 and resides on our website. They're freely available on our website, and everyone is welcome to access them through our website, wheelchairnetwork.org. And it's my pleasure to invite my colleague, Lee Kirby, to continue with the presentation. Thank you.
Next slide. My role in this presentation is to give a brief overview of the timeline beginning in about 2005 and running up to the beginning of this committee before the committee describes its work. Next slide, please. Back in 2005, there's a World Health Assembly that's listed here on the timeline, but even before that, there had been a variety of processes in use for wheelchair service delivery. for anyone interested in that more ancient history, they can have a look at Greer's paper, the reference for which is shown in the bottom left, in which they did a scoping review of 24 studies, or papers at least, that describe different processes, and including the WHO process that I'll come to in a minute. So it's not that everything began anew with the World Health Organization guidelines, but that just was the crystallization of it. To lead up to that, most immediately, however, there was a consensus conference in Bangalore in 2006, and it was really the results from that led to the guidelines. Next slide, please. The WHO guidelines were for the provision of wheelchairs in less resource settings, and it really focused on manual wheelchairs and with manual wheelchair users. But it soon became apparent that these guidelines were relevant to people in all resource settings and for any type of wheelchair, although some adaptations would need to be made. This publication in 2008 really was the catalyst, I think, for a great deal of discussion and research related to the provision process that continues today. Next slide, please. Arising from those guidelines, there were a series of documents that we'll come to in a moment, but the first of those was 4 years later, in 2012, which was the basic level package that came out. This package was intended for in-person education of wheelchair service providers, and it was boiled down into a package that was about 40 hours in length, and it included integrated theoretical and practical aspects to it. Some of the illustrations that were so well done within the package are shown on the left of the slide. Next slide, please. However, the ISWP was using these packages, but also was using other resources, some of which are shown in the, or can be accessed looking at the link shown at the bottom of this slide. Such other resources would included the University of Pittsburgh repair and maintenance package, the Dalhousie University Wheelchair Skills Program, and so forth. In addition, this committee, earlier versions of this committee, developed a hybrid option whereby people could take the theoretical content at their leisure and in their own time, asynchronously, before getting together for a smaller period of time than the 40 hours, perhaps anywhere from 1 to 3 days were various ways in which this was operationalized, I should say. Next slide, please. So this really brings us up to the impetus for the work of the committee that's being reported today, in that it became clear that the flexibility was a bit of a problem. This related to a two-edged sword, these great graphics and multiple languages that the materials have been translated into made it just more difficult to make any changes because you would have to change all of these aspects. And the number of stakeholders involved, of course, that should be consulted to before making changes has limited the flexibility. Also, there was really no mechanism in place to maintain content currency, which is to say, as new evidence became available, it was not integrated into the materials because there was no real way in which that could be done easily. So the content, some of the content that was originally there would no longer appropriate. As new content would need to be added. The balance between different sections, for instance, training versus pressure ulcers, all of these needed to evolve on the basis of the experience in using the materials, but also the research evidence that continued to become available. Next slide, please. So that really was the background of the project rationale. The ISWP modules were really ready and eager. People involved were eager to update them, and that's really what's been going on, and we're reporting that here. The goals were to streamline and reorganize the content and to update the content as well. Next slide, please.
Thank you so much, Lee. So with that nice background, I'd like to now talk a little bit about our project methodology and then take you through our results. In terms of the methodology, the integration subcommittee members reviewed the World Health Organization wheelchair skills basic level reference manual. Once we had done that, specific topics were sent to subject matter experts for further review. And from there, a team of the integration subcommittee created webinars with updated information on the WHO 8 steps. Next slide, please. So you can see here, there's a visual representation of what we did. What's seen in purple was the first year of our work, was a lot of reading and reviewing. And then since the fall, we have been updating the webinars and presenting our progress and options for next steps to the greater committee. Next slide, please. So now I'd like to take you through some of our results. Next slide, please. Although our original goals were to reorganize some of the content and update some content, we actually realized that our results could be categorized into 3 main sections: terminology, organization, and content. Next slide, please. So throughout this presentation, we've tried to denote our organization with pink and that symbol to the right, our content in blue, and terminology in yellow. Continue, please. So first, I'd like to talk a little bit about the terminology. Next slide, please. Terminology has been updated throughout the manual based on both expert opinion and published recommendations. So for example, one of our expert reviewers suggested that we change the term sitting upright to a neutral sitting posture. And then we had some published recommendations suggesting things that pressure ulcer should now be referred to as pressure injury, and then a variety of terms that are now used to describe the body measures and wheelchair components. I'll go through some of these in detail. So if we look at sitting upright, change the term neutral sitting posture, this term provides a little bit more context to the word sitting upright. So we know that posture is the way a person's body parts are arranged. And so wherever possible, a well-fitting wheelchair should support wheelchair users in a neutral sitting in an upright posture. Next slide, please. So why do we change this terminology? Well, upright tends to mean not lying down, whereas neutral posture is a little bit more specific. You can see here that neutral posture tends to refer to the pelvis being upright and level, the trunk upright with back following its natural curves, the hips and legs slightly separated, knees and ankles are at 90, and the head upright and in midline. Next slide, please. And so as a reminder, we're just talking about the basic training packages here. So we're assuming that we're talking about individuals who are able to sustain this neutral sitting posture without any added supports. Next slide, please. The second piece of terminology that I'd like to discuss is pressure sore, now being referred to as a pressure injury. And this is one of the things that was recommended by the National Pressure Ulcer Advisory Panel. Next slide, please. And you can see here that this is the definition of a pressure injury. It's localized damage to the skin and or underlying soft tissue, usually over a bony prominence or related to a medical or other device. The injury can present as intact skin or an open ulcer and may be painful. The injury occurs as a result of intense and or prolonged pressure or pressure in combination with shear. The tolerance of soft tissue for pressure and shear may also be affected by microclimate, nutrition, perfusion, comorbidities, and the condition of the soft tissue. And so why did we change this terminology? Well, this change more accurately describes pressure injuries to both intact and ulcerated skin. In the earlier staging systems, stage 1 describes suspected tissue injury, whereas other stages described open ulcers, and this led to some confusion. So if we look at the next slide, you can see now that the NPIAP pressure injury stages are all referred to as pressure injuries, and this leads to less confusion. Next slide, please. And then the third piece of terminology that I'd like to talk about in terms of our updates is the terminology surrounding body measures and support surfaces. And so although there are many body measures and support surfaces, we are only going to focus on those used in the basic training package. So we're going to talk a little bit about why these terminology updates were needed. Tremendous variation exists in terminology used to describe postural measures and wheelchair components. We know that standard terms and definitions facilitate effective communication among wheelchair providers. And these standard terms and definitions have been described earlier in 2013. However, these standard terms have not been reflected in the WHO guidelines, and accordingly, they have not been reflected in our ISWP online learning modules. So what we've done, if we look at the next slide, is we've updated all terminology for measurements and wheelchair components to align with these two publications: the Clinical Application Guide to Standardize Wheelchair Seating Measures of the Body and Seated Support Surfaces, and the Glossary of Wheelchair Terms and Definitions. Next slide, please. So I'd like to start by looking at the Clinical Application Guide to Standardize Wheelchair Seating Measures. Next slide, please. And we know that body measures can be put into two components. We have our linear measures and our angular measures. The basic manual does not include angular measures, so we're not going to discuss those in this webinar. We're going to focus only on the linear measures. Next slide, please. So you can see on the left, the original terms listed in the WHO guidelines, things like hip width, seat depth, calf length, etc. If you look in the middle column, you can see that these are the terms that have been revised. So for example, thigh depth, lower leg length. And you can see that the definition is then listed in the column to the right. And so if you can change the slide, Krithika. You can see here that we also have, there's a picture here showing those same definitions. Next slide, please. And so we've also updated the terminology for words pertaining to the actual wheelchair. So next slide, please. And so we're calling these support surfaces. So we know that surfaces in a wheelchair intended to contact the user's body are called supports, versus previous words to describe this were rests, plates, pads, etc. Support conveys an active image and required element for posture and seating. And support surfaces labeled by the body segment it is intended to contact. So although there are many body measures and support surface measures, again, we are only including those that are used in the basic training package. Next slide, please. So you can see here a similar table. We have the original words listed on the left and the revised words in the middle column. So for example, you see footrest has now been changed to foot support throughout. Backrest has been changed to back support throughout. And again, this is because the word rest is passive and may not fully convey a component's importance in positioning, whereas the word support more appropriately describes what we're looking for. Next slide, please. So that was the terminology or examples of the terminology that we've changed throughout the modules. I'd like to talk a little bit now about how we've reorganized some of the content. Next slide, please. So we've reorganized information among modules, combining some theoretical and practical information from the WHO guidelines, and we've also reorganized information within modules. So I'd like to talk first about, next slide, please. I'd like to talk first about the reorganized information among modules. Next slide, please. So you can see here that we have combined, if you look in yellow there, we've combined the theoretical modules, the A4 sitting upright, and with the physical practical modules, B1 through B4, there on the left, and we've combined all that information into steps 1 and step 2. Next slide, please. Similarly, for steps 3 and 4, we've taken the theoretical information listed in the A's, appropriate wheelchair there, and we've combined it with the practical B5 and B6 and combined all that information into steps 3 and 4. Next slide, please. Same has been done for steps 5 and 6. Next slide, please. And the same has been done for steps 7 and 8. So I'm going to show you an example now of what I mean in terms of reorganizing information within modules. So next slide, please. So as I've just shown, we reorganized information among the modules, and now we're going to look at step 7 and 8 and looked at how we've reorganized information within step 7 and 8. And I'd like to pay particular attention to the B11 user training. Next slide, please. So you can see that we have further categorized user training into 5 key components. We have transfers, mobility skills, preventing pressure injuries, looking after the wheelchair at home, and what to do if there's a problem. Next slide, please. We further organized the skills of transfers and mobility skills based on independence level. Next slide, please. So you can see here under transfers, we've further broken down transfers into independent transfers and assisted transfers, and then broken down assisted transfers into by a person, are you assisted by a person or assisted by technology? Next slide, please. And so you can see what's been included within the independent and assisted transfers. So for example, we've shown independent transfers, both sitting pivot, standing pivot, and from the ground to wheelchair. And then we've also shown different assisted transfers. So with a transfer board or with a lift. Next slide, please. For mobility skills, we've done things similarly. So we've described mobility skills in terms of independent mobility skills as well as assisted mobility skills. Next slide, please. So you can see the skills ranging from the simpler skills, pushing all the way up to the far right there, the more difficult skills going downstairs. And we've shown how these skills can be done both independently as well as assisted by a caregiver. Next slide, please. And we've also put some information about pressure injuries into this module. Next slide, please. So you can see steps 7 and 8 listed down there in the bottom right, but you can see also in blue A5 pressure sores, or what was originally called pressure sores. We have taken some of that information and placed it into the step 7 and 8 module. Next slide, please. We did this for 2 reasons. One, we reviewed the information from the introduction to highlight the need for pressure redistribution. And we also came to the conclusion that pressure redistribution is a user skill that needs to be taught. So that's why we put that information within the skills section. Next slide, please. So that's an overview of the terminology that we've changed throughout much of the manual and the organization, how we've reorganized some of this material for our online modules. Now, Sarah's going to talk a little bit about the content that we've both updated and added.
Thank you, Amira. So I will talk a little bit about the modifications we did regarding content. So as Amira just shared, for user training, we have transfers, mobility skills, preventing pressure injuries, looking after the wheelchair at home, and what to do if there is a problem. We didn't modify anything regarding the 2 last items, but for the main 3 items, we did add not only modifications in the terminology and organizations, but also in the content, which is what I'm going to share right now. So for transfers, as Amira mentioned, we had independent and assistant, and in independent transfers, we have sitting pivot, standing pivot, and transferring from the ground through the wheelchair. And for assisted transfers, we have with a transfer board and with a lift. We are going to add different videos to all of these type of transfers. So the people that are looking at this information of webinars are able to see the different skills that they need to teach to the user and how to do so in an appropriate way. So for mobility skills, we have all these different skills from pushing to going upstairs and downstairs, as Amira already mentioned, and we added videos for each of these. These videos were part of the wheelchair skills training program. So in this example, we are going to see how to go downstairs. In the first portion of the video, we will see how to train the user to go downstairs independently. And then in the second part of the video, we will see how to train the user to go downstairs assisted. So let's go to the second 14 to see the first part.
Are you able to come down the stairs?
Yep.
How would you do that?
I'm going to go backwards and use a handrail.
Okay, I'll spot you.
Okay.
Spot her on. Good job.
So this is a great resource for the clinician to teach the user how to go downstairs independently in this case. And if we go to the second 59, we can see how to do it with assistance.
To help her get down the stairs?
Yeah, as long as I can get you to help us.
For sure.
So it'll be just the same as when we came up the stairs. I'll get you to push against the front here to keep it in contact. I'm going to tip back and she's going to control her own
Okay,
wheels.
sounds good.
We'll come to the edge. Can you lean back? We're going to pop you up a bit, tiny bit.
Okay, I'm on the front.
And on when we go, remember we're going to go 1, 2, 3, go, and that's when we go. Ready? 1, 2, 3, go. 1, 2, 3, go. 1, 2, 3, go.
So those are the resources we have added regarding content. We also have for going downstairs and for all of the different skills we just mentioned, as well as for full wheelie and all of different skills. So there are some important notes that we also added regarding content. The wheelchair user should be appropriately trained on the different skills in order to use his or her wheelchair. And more than one session is probably needed to ensure appropriate training. So this is something really important that in just one session, the user won't be able to do all the different skills he or she needs in order to use the wheelchair. Back to you, Amira.
Thank you, Sarah. I'd now like to introduce Paula Rushton, who is going to describe our knowledge translation plan and outline some complementary resources.
Thank you, Amira. And so earlier in the presentation, Lee Kirby nicely outlined some of the primary training resources that have been developed in the past by the World Health Organization and also ISWP. And although our presentation today focused primarily on the updates to the ISWP modules, there are 3 other resources that we'd like to take a couple minutes here towards the end of the presentation to share a little bit of information with you about. Next slide, please, Kritika. So these 3 resources include the World Health Organization's new wheelchair service standards, the ISWP basic test version 2.0, and also the ISWP wheelchair educators package. Next slide, please. Thanks. So in terms of the WHO wheelchair service standards, in terms of a conversation that we had with one of the lead developers of this project, Rachel Cowan, in an earlier integration subcommittee meeting, our understanding of these new standards are that they will differ from the original guidelines published in 2008 in terms of they will cover all settings as opposed to just low resource settings, cover manual and powered wheelchairs as opposed to just manual. It's going to cover across the lifespan, so from pediatrics to older adults, but this time will include full-time users as well as intermittent use. And the content will be focused on services and the importance of services. Next slide, please. The ISWP basic test is a test that was developed back in 2015 in order to evaluate the competency of wheelchair service providers. It's based on the WHO wheelchair service training package basic level. It's available in 15 languages, and to date, we've had over 5,000 test attempts from 108 different countries. So all of that data has allowed us to do a statistical analysis, and from that analysis, we've identified some problematic items. And so Yohali Barola Mendez is leading a group of content experts to do an update that's pretty similar to the update that's being done with the ISWP online modules. So the content experts are updating the content of the test items as well as the terminology based on latest evidence. And we're also updating the domain allocation and response options for different items. And so once this content validation has been completed, ISWP will then use the next set of test takers in order to evaluate other measurement properties of this new version of the test, which is version 2.0. Next slide, please. And the third different training resource that we'd like to highlight for you today is the ISWP Wheelchair Educators Package. And so this is a resource that we are developing in order to guide educators in terms of how to integrate wheelchair content into university healthcare professional programs, as well as regional training centers. And so the educators are the target population for this resource. And it's being currently developed by 32 different members from 21 countries across 9 professions. And that's been really important in terms of ensuring that the content that we develop and the resources that we choose to include will be really pertinent across all settings. And so you can see on the right-hand portion of this slide, the process that we've used from July 2020 to December 2021 2021 in order to develop the package. And currently at the moment, we're piloting the package with a group of representative educators from low to high resource settings and occupational therapy, physical therapy, and prosthetics and orthotics. And we will be modifying the package based on the results of the pilot, and we'll launch it in September 2022. And so these three resources, in conjunction with the ISWP online modules, are complementary resources that, of course, can be used in order to both train and to test the competency of wheelchair service providers. Next slide, please. So how are we disseminating the information about the updates to the ISWP online modules? At the moment, we are developing presentations. These presentations a presentation will be developed for each online module in order to identify the changes that have been made, and links to these presentations will be put at the end of each of the online modules. We're also developing videos to incorporate it into the modules. And of course, the links will be added and they will be published as well in the ISWP YouTube channel. And finally, we're developing a webinar series where we will share information about the proposed modifications to the modules. We're going to take this as an opportunity to get feedback from the sector, and the webinar series will also be published on the ISWP YouTube channel. Next slide, please. We anticipate that we'll be offering the webinar series in April. You can see the schedule on the slide. If you are interested in receiving information about the webinar series, you can please feel free to click the link, which is directly under the table of the timeline. That will bring you to a Google form where you can complete the form with your name and your email address, and that way you can stay up to date. We can let you know when their webinar series will be happening. Or you can simply go on to our website, the wheelchairnetwork.org, in order to check out the events calendar to see when the sessions will be offered. Next slide, please. So what's been described for you today are a little bit about the existing ISWP online modules, the information that's been updated in terms of content, terminology, and organization, and how we're sharing this information right now in terms of the presentations, videos, and webinars. Our next step, of course, will be to put everything, all of these resources together into one package. And we will do that when funding and resources are available to do so. And once again, you can definitely stay tuned for when that part of the process will happen by checking out our information on our wheelchairnetwork.org website. Next slide, please.
Thank you, Paula. So just quickly before we end, I'd like to highlight some of the resources that we spoke about during this presentation. Next slide, please. So you can see them listed here. The first two look at the updates to terminology. Those are two references we used in terms of updating our terminology. The wheelchair skills program is highlighted throughout our wheelchair user skills training. And then again, we spoke about the National Pressure Injury Advisory Panel, and that's the information that we use to guide the change from pressure ulcer to pressure injury. Next slide, please. We also spoke about our subject matter experts, and we sometimes refer to them as our external reviewers, and they are listed here. Alicia Kuntz, Michelle Lang, Sharon Sonnenblum, Kelly Waugh, and Jean-Anne Zollers. We'd like to thank them so much for their help and contribution throughout this process. Next slide, please. So if you're interested in getting involved with the ISWP, you can follow the link listed down there below. If you click on that link, it will take you to our homepage, and we're always excited to have some new members. So with that, I'd like to say thank you very much for your time and listening to this presentation. If you're interested in the Wheelchair Educators Package that Paula spoke about earlier, you can tune in on Thursday at 10:15 New Zealand time and watch her presentation titled Wheelchair Educators Package, a tool to enhance wheelchair education globally. So thank you again,